Welcome back to our channel. Today's topic is something that many people are struggling with, and that's anterior pelvic tilt. It's a condition where the front of the pelvis tilts forward and downwards, causing low back pain, poor posture, and even reduced mobility. But don't worry, because in this video, I'm going to give you a step-by-step guide on how to fix anterior pelvic tilt. Before we dive into the exercises, let's first understand what anterior pelvic tilt is and what causes it. Anterior pelvic tilt occurs when the hip flexors become tight and glutes become weak. This can happen due to a sedentary lifestyle, excessive sitting, poor posture, and lack of exercise. When the hip flexors become tight, they pull the pelvis forwards, causing the lower back to arch and the abdomen to protrude. To fix anterior pelvic tilt, we need to strengthen the glutes. The glutes are the largest muscle group in the body and play a significant role in stabilizing the pelvis. There are several exercises that you can do to strengthen your glutes, including squats, lunges, hip thrusts, and deadlifts. Start with bodyweight exercises and gradually add weights as you get stronger. The next step is to stretch your hip flexors. Tight hip flexors are a common cause of anterior pelvic tilt, and stretching them can help alleviate the condition. One of the best stretches for hip flexors is the lunge stretch. To do this stretch, lunge forward with your right leg and place your left knee on the ground. Push your hips forward until you feel a stretch in your left hip flexors. Hold the stretch for 30 seconds and repeat on the other side. Another important step in fixing anterior pelvic tilt is to strengthen your core muscles. Your core muscles help stabilize your spine and pelvis, preventing excessive arcing of your lower back. Some of the best exercises to strengthen your core include planks, bulldogs, and side planks. Lastly, improving your posture can also help fix anterior pelvic tilt. When you have good posture, your pelvis is in a neutral position, which can help alleviate the condition. To improve your posture, try to stand up straight with your shoulders back and down. Avoid slouching or leaning forward, as this can exacerbate the condition. So there you have it, a step-by-step guide on how to fix anterior pelvic tilt. By strengthening your glutes, stretching your hip flexors, strengthening your core, and improving your posture, you can alleviate this condition and improve your overall health and mobility. Remember to start slowly and gradually increase the intensity of your exercises. And as always, be patient and consistent, and you'll see the results over time. Thank you for watching, and I'll see you in the next video.